Welcome back, everyone. Thank you for staying with us here. We know coronavirus is impacting every single aspect of the world as we know it. We've been inundated with new information, so that's why we're here right now, to kind of sort through all the information that you really need to know. And we want to give you the insight and the perspective from real experts so you can navigate this unprecedented time. We know isolation can help slow the spread of the virus. It can also bring on a whole new set of challenges. So thank you for being here with us. I'm Whitney Ward. Our continued promise to you is to just bring you the facts so you can put your coronavirus fears into perspective. It's important. So tonight we are addressing how to cope mentally and emotionally during this stay-at-home order and all of the uncertainty that kind of goes along with staying at home. So right now you can text us your questions and your concerns, especially as it pertains to the emotional toll of all this. You can see the number right there on your screen. Just send a quick message right now to 509-448-2000. So as families are coping with increased restrictions on social interaction and of course tremendous financial pressures, it can feel like too much sometimes. So to help you cope with the isolation and stress, we are bringing in a special expert. This is Dr. Sarah Arpin from Gonzaga University to kind of answer your top questions. She's a psychology professor at Gonzaga. Right now, she leads the Social Emotions, Relationships, and Health Research Lab at GU. So Dr. Arpin, thank you so much for taking the time to talk with us. We are so grateful for having you here.
No worries.
So right now, one of the first questions that we've been getting, who is the most at risk right now as we think about everyone who is used to being out and about in society suddenly kind of being shuttered in their homes for an indefinite time period?
Yeah, absolutely. So whereas everyone is really susceptible to periods of isolation and loneliness, so loneliness is generally thought of as like perceived isolation. There are particular at-risk groups, and this tends to be older adults. These individuals are thought of as most at risk, and they may already have underlying health issues, which could be exacerbated by some of the health consequences of isolation. Other at-risk groups include the socially marginalized, so the homeless are of great concern. So again, these groups may already be susceptible to poor physical health, and so this might be exacerbated by forced isolation.
So kind of a good reminder, it sounds like, for us, even though we can't physically go check in on our neighbors or people in our family who are extended family members or friends, still a good reminder, though, to check in on them through the phone or video chats, that type of thing?
Absolutely. So literature has shown that loneliness, isolation relates to poor physical health in itself. So early onset mortality, morbidity. And so absolutely, in times of stress, especially now, we should be checking in on those around us, but also looking out towards those who may be isolated without family and friends in the large community.
Another question that we are getting is, how do people manage the stress of kind of this new family dynamic? You know, a lot of us are trying to work from home, or at least partially working from home. We're all trying to still stay productive. Our spouses might be there. Our kids are there. Everything is really different, and that's really stressful.
Absolutely. So relationships are a very important source of support, but they can be a source of stress as well. And certainly during this time, there's a lot of stress and a lot of tension as both parents may be working from home, kids may be at home. So clear communication will be very, very important. Sitting down as a family and having a meeting about a new routine. For parents, it will be important to give one another a break, give one another alone time to step outside, away from the stress of the home. So clear communication, time and time again, has been shown as essential for a stressful relationship experience.
We put together kind of a graphic, just some of those key reminders about keeping a routine, as you mentioned, writing out your schedule, taking those breaks, even eating at normal times like you would get up at your normal time. Even if you're not necessarily going into work, it's still important to keep that normal schedule. We know that there's a lot to come still on this issue with coronavirus. We're not entirely sure even how long we're going to be in this situation, so we know that regular routine is critical. We also have a lot more questions that we're getting in through our Zip Whip here platform. Again, a reminder to send those questions to us right now. The number is 448-2000. We have a lot more to tackle on our mental health Q&A here. And coming up right after the break, Dr. Arpin will be back to talk more about that panic buying that we've been seeing at the stores. People stockpiling things like water and toilet paper. So she's got some advice on what we can all do to kind of settle our nerves. We're going to take a quick break and we'll be right back.
You're watching KREM 2 News at 4.
Welcome back, everyone. I'm Mark Hanrahan reporting live from my home here on the South Hill as we here at KREM 2 practicing social distancing. So I'll be broadcasting, anchoring the evening shows from my house for the foreseeable future until things improve a bit. In the meantime, let's talk more about this phenomenon, this panic buying right now. Spend any time on social media and you will see the memes and the pictures, empty store shelves, and it's not just people buying food. I mean, good luck finding things like hand sanitizer, toilet paper, or Clorox wipes. It may seem laughable to some people, but it is a real concern to many others. And despite calls from the local sheriff all the way on up to the president, people are still doing it, and it needs to stop.
The latest clip to make the rounds is from a critical care nurse in the UK brought to tears by a lack of food in the supermarket.
I'm a critical care nurse. I've just finished 48 hours of work. I just wanted to get some stuff in for the next 48 hours. There's no fruit, there's no vegetables. I just don't know how I'm supposed to stay healthy. And nurse people and people are just stripping the shelves of basic foods.
Imagine working 2 days straight amid a global pandemic only to find empty shelves because people are panic buying more than they need. It's a problem we've seen here too, and Spokane County Sheriff Ozzie Knezevich says it needs to stop.
You need to stop over shopping. You need to let those supply chains rebuild.
We've seen the videos of long lines at Costco and Spokane Valley and across the nation. The toilet paper aisles have been cleaned out for a couple of weeks now, and with Clorox wipes pretty much impossible to find, people have also been snatching up baby wipes, even though they don't have children. One viewer wrote to us saying, "My son and daughter-in-law can't even buy baby wipes for my 1-month-old granddaughter." It's all just adding to the stress and anxiety of the current situation we find ourselves in.
There's no shortages. We have no shortages other than people are buying anywhere from 3 to 5 times what they would normally buy.
This week, several grocery stores have set aside time for seniors and other vulnerable populations to shop before the crowds arrive. A necessary but avoidable step if we look beyond ourselves and think of people like that critical care nurse.
Stop it, please.
Or first responders who can't get to the store at normal times like the rest of us. It's easy to say we're all in this together. Let's start acting like it.
We want to get back now to Dr. Sarah Arpin. She's a psychology professor at Gonzaga University. And doctor, thanks again for joining us. What do you make of this panic buying going on right now?
Yeah, as social animals, humans are very prone to this kind of behavior, and it's rooted largely in looking to the behavior of others as evidence for what we should be doing at a given time. So this is especially true in times of uncertainty or stress. If I see my neighbor buying tons of toilet paper, I think that's what I should be doing too. And this is just a part of how we function as social animals. There's ways to avoid this. Another root of this panic buying might be what we call the principle of scarcity. When things are scarce, we tend to want to buy them more. And so how we can combat this is really just recognizing that everyone is needing supplies, keeping in mind the greater community, following the recommendations of our officials who are saying stock up for a few weeks, but remember others need to do the same thing too. So in order for this to work, everyone has to keep this in mind. Remembering and considering stockpiling is not in the service of the greater community. You can get the supplies that you need. Recognize that some of that behavior is really probably driven by observing what other people are doing.
Right. I'm trying to think back, at least in my career. I can't remember a time where I've seen panic buying happen like it is right now. Can you?
Not really. So again, this phenomenon of scarcity is something that is predominant in persuasion, marketing. A lot of companies use scarcity to get people to buy things outside of the coronavirus. So it happens, and I think this level of panic buying is just something that is rooted in people's fear and uncertainty in these times.
Yeah. All right, doctor, thank you very much. Yeah, everyone just take a breath. There's enough to go around. Just get what you need and leave some for everyone else. Thank you very much for your time. We have much more of our KREM 2 Town Hall still ahead tonight, but as we leave you for one quick break here, we want to leave you with a moment of Zen. Take a look. We'll be right back.
Consider this line, the upper limit of our country's medical capability. Most days we're well below it. The system works well. People who are sick receive care. Enter COVID-19. Right now the numbers are low. So low the system can't handle it. Yet we know every person who gets the virus is likely to infect at least 2 other people. And that's why the numbers will continue to grow exponentially. Take Italy. In mid-February, the country had 3 cases and no deaths. The next week, more than 300 cases, 11 deaths. The next week, more than 2,500 cases and 80 deaths. The next week, more than 10,000 cases and 631 deaths. It's all pushed the country's healthcare system to its brink. This is what the U.S. will now attempt to avoid by trying to slow the spread over a manageable time. Infectious disease experts call it flattening the curve. And the more people who join, the flatter it gets. Sports fans who can't attend games, college students who won't attend class in person, canceled parades, conferences, concerts, people who wash their hands consistently, the sick who stay home. The more of us who sacrifice the norms of our daily lives, the more this works. Should this fail, people in the country, perhaps people you know, will unnecessarily die in a system that can't handle the spike. Health experts acknowledge COVID-19 appears to be at least 10 times deadlier than the flu. And those 65 and older are most at risk. Should it spread to half of the country, more than 1 million will die. But it's not all bad news. You have a role here. Yes, you. Remember, if you get sick, you're likely to infect 2 others. 80% of us who get sick will be fine. But even those who show mild symptoms will spread the virus. That's why you need to join in. Flatten the curve, avoid a quick spike, allow our medical system the ability to handle the cases that are coming, because they are coming. In Spokane, Regina On, KREM 2 News.
Welcome back. Today we are trying to answer some of the top questions that you have concerning mental health as we are under this stay-at-home order in an effort to flatten the curve. So with us again tonight is Dr. Sarah Arpin with Gonzaga University, helping us to kind of understand and process our current situation. So one of the questions that I just got here from someone out in the community, specifically saying, I have an autistic son. How do I help him? There's been so much change. It's getting really overwhelming between losing the routine of school, field trips, multiple therapies, and now parks are closed as well. And I think a lot of people, for different reasons, can relate to this because a lot of people have family members who have different special needs, and a lot of people struggling under the weight of that.
Right, so certainly this changing routine can be very uprooting. And I would say, do not be afraid to reach out to your kiddos' support providers, teachers, therapists. There are ways that these individuals can help with the transition even from a distance. So I would encourage you to seek help from those who are already supporting and were supporting before asked to social distance.
And I know that we're not yet talking about the financial impact. That's actually our topic for Thursday when we do another one of these question and answer segments for the 4:30 hour. But a lot of people are definitely worried about finances. How do you try to kind of rein in that panic, that worry, when we really don't even know yet? It's kind of hard to understand. It's hard to process where we could go. There's so much unknown. How do you help people kind of rein that in?
Yeah, similar to the panic buying, I think a recommendation would be just to stay calm. we don't know anything yet. Rushing out and selling your house all of a sudden may not necessarily be the best idea. So staying calm, seeing how things play out. Of course, continuing to listen to the news, but it may be a good recommendation to step away from the bad news for a while and take a walk outside. Staying calm is just a really important piece of advice.
Really important advice. Dr. Sarah Arpin, thank you so much for your time tonight. We're going to take another quick break. You're watching KREM 2 News at 4:30. We'll be right back. Well, for the latest coronavirus developments, remember you can text the word FACTS to 448-2000. We'll be right back for KREM 2 News at 5.